Inspect our patient, make sure her coloration is good, make sure she has a good disbursement of hair, she has full eyelashes and eyebrows, and there are no lesions or any kind of protrusions that I can see. So we're going to go ahead and just palpate a little bit on her face. Let me know if you have any tenderness. And then we're going to palpate the cranium all the way back to the occiput. Everything feels good. I don't feel any bumps or anything or any depressions. Now we're going to go ahead and palpate her sinuses. Just let me know if you have any tenderness there either. I don't feel any swelling though, so it's good. And now we're going to go ahead and look at her symmetry. She has symmetric. Her ears are symmetric also. And could you go ahead and smile for me and frown and blow your cheeks out? Okay, stick your tongue out. Tongue is symmetric and expressions are fully there. Now we're going to go ahead and palpate for the temporal arteries. And I feel them. And now TMJ, could you open and close your mouth? One more time. Okay, I don't feel any popping. And now if you could clench your teeth for me for cranial nerve 5, good. And now close your eyes, and when you feel this, just let me know.
You feel it? You feel it? Yes.
Okay, so she has full sensation. And now I'm just going to have you open your mouth against my resistance. Okay, good. And now we're going to move on to the Snellen chart for cranial nerve 2. And if you could just read the lowest line that you can.
PECFD.
Okay, good. Other eye.
PECFD.
Okay, good. 20/20 vision. Now we're going to go ahead and take a look at your pupils. Okay, they are reactive to the light bilaterally. I'm going to go ahead and take a look at her sclera. It's white and clear on both sides. Her conjunctiva is pink and moist. Okay. And do you feel any tenderness when I'm palpating around your oculars?
No.
Okay. And now we're going to go ahead and do chest for accommodation. Can you look at the pin light and then the wall behind it? Okay, good. And you can see her eyes moving to focus. And now we're going to test her 6 fields. Okay, good. And I'm just going to look at the side at her iris and her corneas. And they're good and clear bilaterally. So now we're going to go ahead and palpate the nose. It is a line in midline of her face. And could you do patency for me? On the other side. Okay, good. We've already palpated her sinuses. So we're going to move on to the ears. I don't see any drainage or lesions. Is it sore at all when I palpate?
No.
What about this side?
No.
Okay, we're going to perform the whisper test. So just let me know what you hear.
Brownie. Cookie.
Okay, good. Now we're going to move on to her mouth. Her lips are free of lesions. They're not cracked or dry or anything of that sort. You go ahead and open up for me. Stick your tongue out. Okay, her buccal mucosas are free of lesions and pink and moist. She has a full set of teeth. Her gums look healthy. Her palates are complete. Can I see the floor of your mouth? Go lift your tongue for me. And that looks good. And then can you say, ah? Okay, test your gag reflex. Okay. And when she said ah with her uvula, she had full mobility. It lifted as it was supposed to. Can you open it one more time? And then swallow. Now open back up. Yep, and it's good. And she has no tonsils because she had tonsillectomy, as I documented. And now we're going to move on to her neck. I'm just going to inspect first off. And then I'm going to feel for the alignment of her trachea. And it is aligned and complete. And she has no lesions of any kind. We're going to go ahead and feel for the carotid pulse. Okay, and then on the other side. And now we're going to listen for any bruit. And we're listening with the bell. Okay, I didn't hear anything, so that's good. Now we're going to feel for her thyroid. I'm just going to come from behind you. Okay, and could you swallow? Okay, she had full movement of her thyroid. And now we're going to palpate for her lymph nodes. So we're going to start with the pre-auricle, and then the post-auricle, and then the occiput, and then the submental, then the tonsillar, then the submandibular, and then the superficial cervical, and then the posterior cervical, and then the deep cervical chain, and then the supraclavicular. It's right around her clavicle. Okay, now we're going to do some range of motion with your neck. And you go down, and then back, and then the other shoulder, and then one more time all the way around. Okay, good. Now if you could take your shirt off for me, we're going to go ahead and inspect her back.
There.
Yeah, or if you can scoot back here. Yeah, that's good. Okay, so first we're just going to inspect, and I don't see any abnormal lesions or skin discolorations. So now we're going to go ahead and do tactile perimetis, and whenever I touch it like this, just say 99. So go ahead and say it.
99. 99. 99.
Okay, so all that felt regular. Now we're going to check for symmetric expansion. So breathe in for me. Okay, one more time. Okay, so that was symmetric. Now we're going to go ahead and percuss in all the lung fields. Okay. And now we're just going to palpate a little bit for any hidden nodes or protrusions. Let me know if you have any pain.
Okay.
And now we're going to auscultate. Take a deep breath for me. Okay, she sounds clear bilaterally. So now we're going to test her costovertebral angle just by percussing it with our fists. Okay. You can go ahead and put your shirt back on for me. Okay, now we're just going to go ahead and inspect her upper extremities. They look clear bilaterally, equal, symmetric. I don't see any major lesions or anything, so I'm just going to palpate them a little bit. Just let me know if you have any pain. Okay, and now we're going to go ahead and feel her radial pulse on both sides, see if it's equal. And it is. And then her ulnar. And then her brachial pulse. Okay, so all her pulses are palpable bilaterally. Then we're going to do her capillary refill. Less than 2 seconds on both sides. So now we're just going to do some range of motion with your arms. If you can do abduction, adduction, in front of you, and behind you, and then just circle your shoulders. Okay, good. Now we're going to do your elbows. Go up here and down, supination, pronation. Okay, we're going to do it against resistance with your elbows. And down. Okay. Now we're going to do your wrist. Inward, eversion, around, up, and out fingers, and then touch them, and then ball up in a fist. Okay, good. Now we're going to test your cerebellar function. You do your fingers out here, nose, and then do it a little bit faster. Okay, good. And now we're going to do test your graphesthesia. And we're going to hold out your hands and close your eyes for me. Just tell me what number I'm drawing.
7.
Okay.
8.
Okay, good. Now we're going to do sterganosis, and I'm just going to put something in your pocket, in your hand. You can just close your eyes, tell me what you feel.
A coin.
Okay, good. Now we're going to do your reflexes. We're going to start with the tricep reflex. Okay. Okay, so we're both there. Now we're going to do Okay, so we just tested her tricep, bicep, and brachial reflexes. Now if you go ahead and take your shirt off for me and we'll assess the front. I'm going to have you lie down also. We're just going to start by inspecting her chest and her abdomen and making sure that she's not labored while she's breathing. Make sure there are no retractions or accessory muscles used. I don't see any pulsations or anything that would seem abnormal. So we're just going to go ahead and palpate. Okay, so her chest feels normal and clear, and we've inspected her breathing. So now we're going to go ahead and listen. And we're going to listen for the S1 and S2 first with the bell. We're listening for any regurg or any murmurs. Okay, now we're going to listen with the diaphragm. We're going to listen to the aortic and the pulmonic and the tricuspid and the mitral valve. Okay, and then we're going to listen again with the bell. Okay, all of her heart sounds were strong. So now we're going to go ahead and move on to the abdomen. We're going to inspect again. There are no pulsations that I can see, no distension or abnormalities. So now we're going to go ahead and listen to all 4 quadrants with the diaphragm. Bowel sounds were audible, and we can inspect the umbilicus also, and I don't see any protrusions or abnormalities with that. So we're going to go ahead and listen for the aorta and the renal arteries on either side of it. Okay, and those were heard bilaterally, so we auscultated bilaterally for those. And now we're going to percuss in all 4 quadrants. Okay, and now we're going to start with light palpation. Let me know if you have any tenderness. And then we're going to go for deep palpation. And then we're going to palpate for the liver, right under the ribs. And I don't feel anything, so that's good. You shouldn't be able to feel the liver. Now you can go ahead and put your shirt back on. Go ahead and lay back for me. Now we're going to inspect her lower extremities. I don't see any lesions or any protrusions. Bilaterally, they look clear and normal. We're just going to palpate a little bit. Just let me know if you have any pain or tenderness. Okay, they look good. So now we're going to feel for the posterior popliteal pulse. And then the posterior tibial pulse. And then the dorsalis pedis on both sides. Okay, all pulses were palpable and strong. And now we're going to palpate for any pre-tibial edema, which she has good skin turgor. Everything is returning back to normal. I don't see any signs of edema, and it feels normal, so she's good. And now we're going to do some range of motion with your legs. So if you just pull your knees to your chest. Okay, and then back out. And then you pull one up. And then the other one. Okay, and then do a kind of a split. Okay, good. And now we're going to, can you move your hips outward? Yep, perfect. And then back to normal.